and welcome to Health Hacks with Lloyds Pharmacy. Today I'm here with Matt, pharmacist at Lloyds Pharmacy, and we're talking all about the important condition that is diabetes. Hi Matt.
Hi Jinelle. Yes, this month we've got National Diabetes Week, so it's really important to make sure we're all educated on something that affects so many of us. In fact, did you know that 1 in 15 people living in the UK actually have diabetes, and of those, around 1 million have type 2 diabetes without actually knowing, without being diagnosed?
Okay, so it's actually quite common. What is diabetes for those of us that don't know?
So in effect, glucose is something that creates energy in the body, and of course as we eat food, those glucose levels increase. So the glucose levels don't get too high because that would cause problems. We have a hormone that we produce called insulin, whose role is to reduce that glucose or moderate that level of glucose in the body. In diabetes, those insulin levels are either reduced or non-existent, or actually the effect of the insulin isn't as it would be in a non-diabetic person. That can therefore lead to increased glucose levels and therefore problems.
Okay, so everyone's probably heard of type 1 and type 2 diabetes. Can you just explain the difference for us?
Yes, so type 1 diabetes, first of all, the biggest difference is age. So actually you'll normally get those symptoms onset in childhood, and it can be a more dramatic onset as well. With type 1, actually that's when your body produces no insulin at all, which is another fundamental difference between type 1 and type 2, because in type 2, you will produce insulin, but either a reduced amount or the body's resistance to its effects.
Okay, and is there a difference in treatment between the two?
There are subtle differences in the treatment. So in type 1 diabetes, you'll always be on a type of insulin, whether that be a regular pump or a regular injection. And you'll also have healthy, balanced diet measures and regular exercise, which can help you to feel a lot better as well. With type 2 diabetes, those lifestyle measures are actually the first line. So you'd try those first to see if actually that can control those glucose levels. And if not, at that point, you'd move on to medications, whether that be certain types of tablets that can help, or the insulin, similar to that you would in type 1 diabetes.
Okay, so how would I know if I've got diabetes?
So type 1 diabetes is usually developed in childhood actually. With type 1 diabetes, where it's developed at an earlier age, the onset of symptoms is actually quicker, as it can occur over just a few weeks. You might notice needing to go to the toilet more often than usual, especially at night, feeling thirsty or losing weight where you're not actually trying to. With type 2 diabetes, you're more likely to experience that later on in life and the symptoms develop, usually with a more gradual onset at the age of around 45 or so. Those symptoms can be feeling more tired than usual, which people can put down to other things, hence delaying that treatment and diagnosis. You can also experience some of the symptoms like you would in type 1 diabetes, like needing to go to the toilet more often than usual, feeling thirsty at night, or losing weight where you're not necessarily trying to. We do offer an in-store screening service to check whether you could be at risk of developing diabetes. If that's something of interest to you, you can look on our website for more information or to make an appointment. That's LloydsPharmacy.com.
Thanks, Matt. There's some great advice there for everyone. Comment below with any questions that you have for us, and we'll see you for next week's Health Hack.